What are the innovations in breast augmentation surgeries? How is breast reconstruction performed after a mastectomy? And what is the moment that Dr. Sagit Meshulam, a plastic surgeon, remembers the most from the operating room? We'll hear in a moment. So hello to Dr. Sagit Meshulam, a specialist in plastic surgery from Asuta at the Rabin Medical Center. Full disclosure, Sagit and I studied together. Sagit graduated with honors, and it's always a great pleasure to meet you at Asuta, and especially today.
How many years have passed?
It's scary, never mind. Let's not talk about it.
We were 20 years old, almost 30 years ago.
Exactly.
Yes.
So today we're going to talk about breast surgeries. How common is it in Israel?
All types of breast surgeries are very common. If I take it to the reconstructive field, after breast cancer, we know today that 1 in 8 women, sometimes even 1 in 7, will need some kind of mastectomy, and many times we are involved in the mastectomy. And aesthetic surgeries, breast augmentation is one of the most common surgeries in the Western world today, so there is definitely demand.
Basically, we divide it into aesthetic surgeries, which are augmentation or reduction, although reduction doesn't have to be aesthetic. Sometimes it's actually medical.
Right, functional. Really, yes.
And reconstructive surgeries.
Right.
How does the process before surgery work? I mean, a woman comes to you with, let's put reconstructive surgeries aside for a moment, but let's say a woman who wants breast augmentation.
Yes.
What do you talk to her about? What process does she go through?
Yes. So first of all, I would divide this group of people who come to me into 2. There are these young women, girls, after the army, 20, 22, who have suffered all their lives from having small breasts and a lack of confidence because of it, who come asking for breast enlargement. And then there are the women who are more my target audience, more of the women who actually come to me. And these are women in their 40s who have finished having children, finished breastfeeding, and want to fill out their breasts a bit and go back to how things used to be. So really, when I was younger and these young women would come to me, and I come from a background of reconstructive surgery and big operations, I used to say, why do you need this? So you're an A cup, why do you need to be a B cup? But I really realized that it does make a difference. It changes their posture, it changes their confidence, their whole presence, even the way they speak changes. And many times it's actually the mothers of these young women who come to me afterwards and thank me for what I've done. So we shouldn't underestimate even these simple enlargement surgeries, but mainly my heart really goes out to the older women our age, who just want a little to bring back the old days.
What are the main techniques for breast augmentation?
So basically, breast augmentation is made up of 2 worlds. The world of silicone implants, and even within silicone implants, there are different types. I really like to do augmentation with anatomical implants. But an anatomical implant, unlike a round implant, doesn't have that exaggerated fullness in the upper pole of the breast and gives a very, very natural look to the breast. It's especially suitable for older women who don't want that artificial look at the beach or in a bra and are looking for a more natural appearance similar to an original breast that hasn't been augmented. And these implants are very suitable for natural augmentation. And today, one of the most common fields is fat injections. Augmentation using fat injections is really suitable for a certain type of women who don't want to be too large. We take fat cells from the abdomen, from the waist, places where women in Israel usually have plenty, and we inject them into the breast area.
And where is this done? Also in the operating room?
In the operating room, yes. In the operating room, I really prefer to do it under general anesthesia, not local anesthesia. The woman is asleep, we extract cells and inject them into the breast, and everything is done through small half-centimeter incisions.
Is it a single procedure or several?
So usually I tell the woman that 2 surgeries will be needed, but many times she is satisfied with just 1. If expectations are realistic and she's not seeking enlargement but rather shaping, then a single surgery can be enough.
How do you decide? I mean, how do you decide on the size? How do you decide on the...
First of all, fat injection, it's important to say, is not something you can decide about in advance. It's not like a silicone implant where, let's say, I have a 3D imaging machine that I can use to show a woman exactly how she'll look before and after the surgery, with implant X in size Y. But with fat injection, you suction fat and you don't know how much of that fat will remain Usually 60% of the fat stays, but even if 100% of the fat stays, you don't know how it will look on this specific woman. And that's why when a woman chooses fat injection for augmentation, she needs to know that the result is unpredictable. That means it's impossible to know what size she'll end up with, and she needs to accept that. There are limitations to this.
Is this suitable for every woman? For slim women?
No, it's suitable for women who have the natural resources to provide. That means you really need a woman who has a belly, who has a waist, who has hips. We need to inject at least 200 cc into each breast so that you can actually see something. And 200 cc of fat is not like 200 cubic centimeters of a silicone implant. It's much smaller. So you really need to have a donor organ. Another thing is that I don't like to do fat injections for women who have had breast cancer in their close family because fat injections have disadvantages. They can sometimes appear as calcifications on a mammogram. So there are disadvantages to fat injections, and you really need to tailor the right surgery for the specific woman. Sometimes women come to me for fat injections, for augmentation with fat injections, and they end up with a small silicone implant. We're really hesitant about silicone implants because we immediately imagine that grotesque artificial look, but it's not necessarily like that. There are small and natural looking implants.
How do you decide on the size of the implant?
That's a very good question. So first of all, the woman's width, the width of the breast, is a very, very important factor. The woman's preferences, her skin type, her skin's ability to stretch, all of these matter. In general, I don't usually recommend that a woman go above 300, 325 cc in size. And of course, for young women with a narrow body structure, 250, 275, or even smaller can do the job and give a natural result that isn't noticeable in any situation.
And what's the difference between augmentation and a lift?
That's a good question. A breast lift doesn't always require a silicone implant. One of the lifts I like to do is actually a lift without a silicone implant. With a breast lift, we do three things: repositioning the nipple higher on the breast. Secondly, we tighten the skin envelope over the existing tissue. And thirdly, we do a bit of reorganization of the breast tissue. Because as we get older, our breast tissue sags down, and at the top we're a bit lacking in tissue. So in a lift, we take some of the breast tissue that has sagged down and move it up. Basically, we're reorganizing the breast tissue.
Nice. Breast reconstruction is an important topic to you, and you've become well known for it. Let's discuss it further.
Yes, it's close to my heart.
Who is it suitable for? Who is it intended for?
So really, in recent years, I've been very happy. Almost every woman who has breast cancer at some point comes for a consultation with a plastic surgeon, because it's not only women who need a full mastectomy who need a plastic surgeon. Many times even a woman who needs a partial mastectomy will benefit from the involvement of a plastic surgeon in the process. And I'm happy to see that this is something that has also reached general surgeons, and they know to call a plastic surgeon when needed. So again, I would divide this world of breast reconstruction into two: partial reconstructions after a partial mastectomy and full reconstructions after a full mastectomy.
It's less common today.
Right. Fortunately, it's less common.
I still remember the mastectomies from back then.
That's right.
Which was...
Today, a mastectomy is no longer like a guillotine, contrary to what many women believed during their initial consultation. Modern techniques have evolved significantly, and a mastectomy now involves emptying the breast from the inside rather than the drastic procedure it once was. Many times we leave the entire skin envelope, including the nipple. When the nipple is involved, we remove it while keeping the entire skin envelope intact. And then, basically, the plastic surgeon's job is to refill that skin envelope.
When does the reconstruction take place? Does it happen at the same time as the mastectomy?
Again, today, yes. In recent years, almost all mastectomies are accompanied by reconstruction. For a woman who, of course, wants it, maybe this is really the time to bring it up. Not every woman has to have reconstruction. I say this as a plastic surgeon who loves reconstructions and is dedicated to them. Every woman should know that there is also the option not to have reconstruction. And if she is able not to see her sexuality and femininity as dependent on the organ, and she doesn't want to have reconstruction, it's very difficult. But I have to say that actually in recent years, there's a trend, especially among young women, not to have reconstruction, and I respect that very much. But there are women who tell me, without reconstruction, I won't even wake up from the anesthesia. I want reconstruction.
Is it possible to do the reconstruction at a later stage?
Yes, certainly. For women expecting a difficult recovery from radiation, we often advise postponing reconstruction. We recommend having the mastectomy, completing all oncological treatment, and then pursuing reconstruction afterward. Really, it should just be mentioned that women who undergo radiation and then want to have reconstruction, they won't be able to have reconstruction with a silicone implant. They will need to have reconstruction with autologous tissue.
That's it. What types of reconstructions are there?
Yes. So actually, 80% of our reconstructions are simpler reconstructions with silicone implants. As mentioned, the surgeon completes emptying the breast and fills it with the contents of a silicone implant. The other world, the remaining 20%, is really reconstructions using the woman's own tissues, and this is more suitable for fuller women with large breasts because a silicone implant can't provide the fullness, softness, and sagging that a large breast has. Another type of women who are suitable for reconstruction with their own tissues is women who have undergone radiation, as I mentioned. Women who have had radiation in the past, a silicone implant is not suitable for them. For these women, we do reconstruction with their own tissues, and usually the workhorse in these cases is the abdominal wall. It's the skin and the fat from our abdominal wall.
This is actually a microsurgical procedure.
That's right. The skin and fat from the abdominal wall can best mimic the sagging and softness of a woman's natural breast. What we do is simply take this skin and fat, base it on a vessel. After all, you can't just transfer it. With the blood supply, exactly. We take a small blood vessel, a millimeter or two, transfer this whole complex to the chest, and connect it to blood vessels in the chest so that they supply blood to this complex. And that's how it actually stays alive.
How similar is it to the original breast?
It looks very similar, very similar. I mean, it's really, I call it the Rolls-Royce of reconstructions because unlike a silicone implant that can give you a small breast, maybe a bit artificial looking, reconstruction from our own tissues really can mimic the natural breast in the best way.
What about sensation? Is there a loss of sensation after the surgery? Does it come back after the surgery?
Yes. Unfortunately, many times people forget to tell women this, but the removal of the breast cuts the nerves, and usually the center of the breast, the area of the nipple, and the surrounding area are without sensation. And sometimes the sensation returns in the periphery, but not in the center.
How do you reconstruct a nipple in cases where the nipple needs to be removed?
So that's a question that often concerns women who undergo a mastectomy without a nipple. And really, nipple reconstruction is a very simple procedure that's done under local anesthesia. It takes about 10 minutes. And what we actually do is rotate. It's called a flap in medical terms. We rotate a sort of clover-shaped piece of the woman's own skin from the breast and create from it a three-dimensional structure of a nipple.
But you need it. It's a different color. The nipple is a different color.
That's right, that's right. The woman visits a medical tattoo artist who creates a special color for her. Today, some women are also taking the initiative in this process.
That's their specialty, isn't it?
Yes. There are medical tattoo artists who specialize in this, but nowadays there are women who create all kinds of amazing and special tattoos, taking advantage of the situation. In my opinion, it's very beautiful.
What innovations are there in the field?
In the field of reconstruction, the biggest innovation is actually the fact that even women who need a partial mastectomy now go to a plastic surgeon. Today we take techniques from the field of aesthetic surgery, such as breast lifts or reductions, and we apply them to breast reconstruction after partial mastectomy. So instead of a woman leaving with a chunk taken out of her breast, she leaves with a shaped breast that looks like a woman who had a breast lift or reduction.
We aim to shape the breast as close as possible to the original or even make it look better. In that case, we may also need to treat the other breast for symmetry.
After a partial mastectomy, the resulting breast is often more shaped, firmer, and lifted than the other. The woman can do and even deserves a lift or aesthetic correction of the other side, which is included in the health basket.
Nice. As a woman in the male-dominated field, when I began my residency, I was unaware of any other female plastic surgeons.
Yes, so that's changing a bit, thankfully, but I have to say you're right. For example, in my department, I'm still the only woman. But I see a new generation of female residents coming up, and even in our generation, I'm quite...
Why is that happening? After all, most of the target population is women.
That's true.
Who understands women better than women?
That's true. So now we understand that.
Especially when a woman comes in with breast cancer, it's a very dramatic event.
That's right. You're right. Look, I don't think it depends on the person and less on their gender, but I do think that as women, we can definitely understand that sense of loss better. Yes, definitely, definitely.
Is there a patient you remember in particular?
Yes, yes, yes. Without a doubt, I'll call her Elle. She was a beloved patient who came to me in her early 20s. I had just returned from my fellowship in Toronto. She came to me with breast cancer. Her mother had died at a young age, and she came to me with breast cancer, and her father raised her. She also has an older sister. She came to me with a very aggressive breast cancer. She went through very difficult treatments after the reconstruction, including radiation, and the radiation shrank the reconstruction, and the aesthetic result was terrible. So we did a more complex reconstruction using her own tissues, and really she was so young, and such a blow fell on her. And on top of that, all the dealing with her mother not being there, she was aggressive and was always in opposition to us. And
opposition to what? To the reconstruction?
This whole experience she went through, this whole experience she's going through, it just made her negative. Towards me, towards the nurses, she was really closed off and tense and very negative, and she kept talking about how she would find a guy, how she's young, she's in her 20s, how would she continue her life afterwards. And she got married, had kids. To this day,
she recovered.
She recovered, of course, of course, of course. To this day, and she also managed to have children. I get a picture from her at least once every 2 weeks. She already has 2 daughters, pictures of the girls growing up little by little, and it's really a great joy, a great joy. I really feel like half a mom, yes.
So basically, how does this breast reconstruction process work? Actually, a person doesn't come to you first, they go to the surgeon.
Right, right.
And from the surgeon, does the surgeon refer them to you, or can a person say, I want you to operate on me?
So it goes both ways. Usually every surgeon has a plastic surgeon they work with, and it usually comes as a team. I have surgeons I work with. I don't even need to talk. Like, it's just we communicate telepathically.
I'm always so jealous when I see you in the operating room with the surgeon when you operate together.
Right, right. Surgery is a very lonely field. You probably understand that. In aesthetic surgeries, I'm really alone, pretty much like you, but reconstructive surgeries are really something that's combined. I also really like being there during the removal, helping the surgeon, and a lot of times the surgeon stays to help me. There's a kind of mutual exchange here, and also a lot of times I get referrals from surgeons I haven't worked with yet because the woman asks for me to do her reconstruction, and even then I'm happy. I'm always glad to meet new surgeons.
What do you enjoy doing most in your free time? Do you have any free time?
That's a good question. It's funny because as you get older, you realize the importance of free time and the need for it. Being a doctor is challenging, especially when dealing with breast cancer. It is mentally taxing and difficult. You have to handle a lot.
You need energy. You need to adapt yourself so that...
That's right. So, yoga and meditations, that's something that keeps me balanced.
Every day?
I meditate for just 15 minutes in the mornings. I highly recommend it. It makes you arrive calm. I did it this morning and I'm a different person.
You always...
But the level of calm is different, and also yoga. I try once a week. I can't manage more, but it's a pleasure.
Is there a topic you would like to talk about? A topic we think about less, are less aware of?
Actually, yes. It's a completely different field from what we've been talking about. It's a field that's really started to gain momentum around the world, but here it's still in its infancy. And as a woman who operates and really deals with very intimate things, I would like to raise our awareness about it, and that's the field of gynecological aesthetics. Women, let's say the average number of children here is 3 per woman, and after giving birth, many times we enjoy sex less. We have to say it. That is, our vagina becomes wider. And I push and encourage women to undergo vaginal tightening surgeries. Not for anyone else, not for the partner, not for anything, just for their own personal pleasure. And really, in the United States and Western Europe, this field is developing a lot, really as part of the...
How is such a surgery actually performed? What do they do in the surgery?
So the truth is, it's really not a complicated surgery. Many times I combine it with breast surgery, with a lift surgery, and it's a surgery where, just like in a tummy tuck we remove excess skin and tighten the muscle underneath the skin. In exactly the same way, we do the tightening of the vagina. We remove a piece of mucosa, mainly in the back area of the vagina, and tighten the muscle in that area, and then close the mucosa back up.
Doesn't it hurt? It sounds painful.
It's not a painful surgery, but it took me some time to talk about it as it's a bit embarrassing. However, I really think
there's no awareness.
There's often no awareness of the need for surgery when everything seems fine, but things can change. It's important to discuss it, and I've seen the impact on people who have undergone this procedure.
That's it. What kind of reactions do you get?
They thank me. Forget about the husband who thanks me. But really, the woman feels that it's more enjoyable for her.
There's no loss of sensation?
No, knock on wood, that's not one of the things described. Look, there can always be complications in any surgery, but sensation is not one of the problematic things in this surgery. Again, you need to know where to remove the excess skin and where to tighten the muscle. And when you do it from the back, there's no loss of sensation. So that's my message.
So earlier, you really mentioned that this is done. You sometimes do it while performing a breast augmentation, and you know there's a surgery called a mommy makeover. What exactly is a mommy makeover?
I'm not a fan of that term. Mommy makeover is usually a kind of surgery that used to be called a divorcee surgery. Like a woman gets divorced, and that's why I don't like that term. I call it a married women's surgery, like be married and be stunning. So really, it's a surgery where we combine several areas, and it's usually a breast surgery and a tummy tuck. And many times, as part of the mommy makeover, you also perform a vaginal tightening.
Amazing.
Yes.
Well, sounds fun, Sagit.
The fun comes after, not during.
When do we come to your clinic? Well, I want to thank Dr. Sagit Meshulam.
Thank you very much, Esti.
It was fun, thank you.
For me too.
That's all for today. Join us next time on the Operating Table. In the meantime, feel free to send us your health and surgery questions. Goodbye.